What are the costs of TACE for liver cancer? Transarterial chemoembolization is a common treatment for liver cancer that cannot be removed surgically, but many wonder about the costs involved. The price of TACE varies based on where you are, the type of procedure, and how many sessions you need. In Europe, a typical TACE session costs around 10 to 12,000 euros. If you opt for a newer version called drug-eluting bead TACE, the cost might be slightly higher, around 11,400 euros per treatment. In the United States, the total cost for multiple treatments can range from about $73,000 to over $127,000. This depends on how many sessions are needed and the length of hospital stays. The costs include several parts. First is the procedure itself, which involves inserting a catheter into the liver arteries and delivering chemotherapy directly to the tumor. Usually, patients need at least 2 sessions spaced about a month apart. Each session often requires an overnight hospital stay, which adds to the expense. The treatment also involves imaging scans to guide the procedure, fees for the doctors, and the chemotherapy drugs used. When drug-eluting beads are used, the material costs go up, but this might mean fewer treatments are needed overall, possibly balancing out the total expense. When comparing costs and benefits, studies show that although drug-eluting bead TACE is more expensive upfront, it can be more cost-effective over time. This is because it may improve quality of life and extend survival, which are important factors in healthcare decision-making. Cost-effectiveness is often measured by how much it costs to gain one quality-adjusted life year, and in some cases, drug-eluting bead TACE falls within acceptable ranges for healthcare systems. Costs also vary by country and healthcare system. For example, in China, the cost-effectiveness of combining TACE with targeted drugs depends on local income levels and health funding. In European countries like Italy, the cost per quality-adjusted life year is generally within acceptable limits, making TACE a feasible option for many patients. Keep in mind that many patients need repeated TACE treatments to control tumor growth. Each session adds to the total cost. Hospital stays, managing side effects like post-embolization syndrome, and follow-up care also contribute to the overall expenses. Newer outpatient options and advanced technologies may reduce costs in some cases but are not yet available everywhere. In summary, the cost of TACE for liver cancer usually ranges from about $10,000 to over $100,000 or euros depending on how many treatments are needed and where you are. While drug-eluting bead TACE costs more initially, it might be more cost-effective because of better outcomes. The total expense includes the procedure, hospital stays, drugs, and follow-up. Always discuss with your healthcare team to understand what costs to expect based on your specific situation and location. Remember, individual needs vary, and a healthcare professional can help you weigh the benefits and costs of treatment options.